Hi everybody, my name is Advait and today I'm going to teach you how to manage a case of transient ischemic attack or stroke. If you see such a patient in an emergency department, I'll tell you the exact steps of how to manage such a patient. So, for example, a patient comes with right arm weakness and slurry speech, what you should do. So, in this case, first thing is a focused physical exam. You do a neurological assessment, you do a general exam, you do head and neck, chest, lung, cardiovascular, abdominal exam. You can skip skin, lymph node, breast, genital, rectal exams, but you definitely should not delay neurological evaluation. After this, once you find out that the symptoms and the exam point towards stroke, you immediately need to get a non-contrast CT scan, and this is to rule out hemorrhage and identify stroke. So you order a CT scan, and in the meantime, you should also get IV access, send blood for CBC, get an ECG, and all of these orders should be stacked. So you have patient coming in, and you think it is stroke. You take an IV, you take blood, you take an ECG, and order a CT scan. These are the first thing that you need to do after the initial physical exam. After the CT is done and you have ruled out hemorrhage, you can start aspirin. If the CT is positive for stroke, you immediately have to thrombolize that patient by, for example, alteplase. If it is a transient ischemic stroke, you can start with aspirin. So once everything is fine and patient is a little bit stable, you can complete your rest of the exam, transfer the patient to the ward, tell them to ambulate at will, determine the diet. If the patient is diabetic, start a diabetic diet, do a glucose monitoring 8 hourly, perform a carotid Doppler, echocardiography, order an MRI head or MR angiogram of head, check for HbA1c, lipid profile, all of that stuff. You do all of this once you're done with the emergency orders. So once the carotid Doppler results are in, if the patient shows more than 70% of occlusion or stenosis, then you should get a vascular surgery consult. If there's echocardiogram and shows a thrombus, then you should get a cardiology consult. So all of these things have to happen, and you definitely do not miss carotid Doppler and echocardiogram after you're done with the emergency orders. So I'll repeat what we just discussed. Once the patient comes in, you take IV access, you take blood, ECG, CT. After the CT, you thrombolize or not thrombolize. You start the medications like aspirin and clopidogrel. You transfer the patient to the ward for monitoring, whether there is need for carotid Doppler, echocardiogram, and MRI. You do the rest of the blood work, and then according to the test results, you determine the further management. So this is how you manage stroke in an emergency situation. I hope you like my channel. If you like to see more of this content, please subscribe, and I'll see you in the next one.